This video is for Principles of Anesthesia, Dr. Van Heusen's class, and we will be going over the components of an anesthesia machine and a circle rebreather. So here we go. We're going to start on this end of my poster board, and you'll see there is a set of lungs here for our patient, and you're going to see a tube that splits into a Y. Now, this Y tube can connect to either of these exhalation or inhalation valves. They are ambidextrous. It does not matter which one they connect up to. Okay? It is important to know that the exhalation and inhalation valves have arrows on the side of them to notate which direction the airflow goes into. Okay? This is our E-tank. It is called an E-tank because it is for emergencies and it's portable. The pressurized oxygen inside this O2 E-tank will go up to the yoke. The yoke is actually measured for this specific tank. The two little dots that are shown in blue, those change depending on the yoke that is used for the specific tank that is attached. For this particular one, we're using an oxygen tank, so this is an oxygen yoke. The oxygen goes to the pressure reducing valve. So it'll show under the tank pressure gauge and the line pressure gauge. And this is too high for our patients to breathe. Way too high. A full oxygen tank is probably about 220 psi. The lungs cannot handle that kind of pressure. So what do we need? We need it to go through the oxygen line and into the flow meter. The flow meter will change that pressurized gas to about 10 to 15 psi. And at this point, it is safe. It is safe for our patients. And the oxygen can either go into the pressure vaporizer or it can go to the O2 flush valve. Now, if it goes to the O2 flush valve, be sure that your patient is not connected to the machine. They cannot be connected to the machine, otherwise their lungs will burst. The lines or the tubings, this is the correct way for the tubes to be connected to the flow meter and the pressurized vaporizer. As you can see, it's after the vaporizer. Reason for this is because we want that oxygen and that vapor for the anesthetic to come to the patient. Once it mixes, it's going to go through the inhalation valve. And as the patient is breathing that in, there's going to be a little disc at the top here that's going to let you know they're breathing in. And as they exhale, you're going to see the little disc in here. They're going to exhale and that disc is going to lift up. And it's going to go to either the CO2 absorber or it's going to head towards the pop-off valve where it's connected to a scavenger tube, which will lead to the scavenger. If it goes through the scavenger tube to the scavenger, it's going to filter out that anesthetized gases. That way we do not breathe in those white gases. If it goes to the CO2 absorber, it does exactly what the name says. There are little granules inside this CO2 absorber where the CO2 is absorbed. So the gases, once it goes in, the air is going to come back to where it meets the fresh gas, and then it's going to be breathed in again through the inhalation valve, through the Y piece, and back into the patient. It's important to note that there is a manometer on top of the circle rebreather. Sorry, on top the CO2 absorber. It will be right there. But for this, we have this here. Okay? So this is the manometer. Okay? This is the one that you have to focus on, because this is the one that's going to tell you how much pressure is inside our patient's lungs. We never, ever, ever want to go past 20. Okay? There are 2 scales. Those 2 scales are centimeters of water and millimeters of mercury. The one we need to focus on is the centimeters of water. We never want to go past that 20 centimeters of water. That is the highest point that we can go to, because if we go any further, it's going to burst the lungs of our patients. This is our little rebreathing bag. Okay, same with the rebreathing bag. If we want to give a fresh set of breath to our patient, we need to close off the pop-off valve, and then we squeeze the bag. So we close off the pop-off valve, and then we squeeze the bag, and we make sure that this never goes past 20 centimeters of water. Most pop-off valves will have a little piece to it. I don't know, what do you call it, a button? A button that you can push down instead of closing off the pop-off valve. And that's to prevent you from forgetting to reopen the pop-off valve. So, for the gases, okay, they go from the flow meter to the vaporizer, into the breathing circuit. It'll go to the inhalation valve, to our patient. It'll go back through the exhalation valve. It'll either go into the breathing bag, to the pop-off valve, to the CO2 absorber. Then it'll come back, meet up with the fresh gas, and then back to the patient again. And that is a circle rebreather.